Marcus has been diagnosed with advanced bowel cancer that has spread to his liver. It is a frightening diagnosis, and the fears you are feeling right now are completely valid. But here is the medical reality. The cancer in his liver is confined to one specific area. Because of this, the medical team has established a clear path forward, and they are treating Marcus with curative intent. The core clinical strategy is shrink to remove. You can see the large tumor represented on the left. Over the summer, intensive treatment will reduce its size, shown here on the right, so surgeons can safely remove it later this year. The doctors have a very specific zone of responsibility here. Their primary job is to aggressively engineer the physical removal of the disease. To make that shrinkage happen, Marcus is receiving a modern regimen known as Folfox and panitumumab. As this diagram shows, this highly coordinated triple-threat attack uses 3 distinct weapons simultaneously. The first weapon is oxaliplatin. This is the hospital heavy lifter. It works by tricking the cancer cells so they can no longer repair their own DNA, causing them to stop dividing and die off. The second weapon is panitumumab. Think of this as a smart homing missile. It is a targeted antibody that seeks out a specific protein on the cancer cells and physically blocks the growth signals those cells need to survive. The third weapon is 5FU, delivered via a home pump. This acts as a Trojan horse. It mimics a normal building block the cancer needs to grow, but once the cells eat it, it destroys their ability to copy themselves. This table summarizes the entire matrix. By destroying DNA repair, blocking growth signals, and halting replication, the treatment attacks the cancer from 3 different sides at once to force the required shrinkage. This checklist outlines what we call the launch, starting this Thursday. First, the team will install a PICC line. A PICC line is a long, thin tube inserted through a vein in the arm that delivers medicine directly to the larger blood vessels near the heart. This pump constantly delivers slow-release medicine for the next 48 hours. Once the pump is removed, Marcus has exactly 11 days of recovery. His body needs this specific window to process the heavy medication and reset before the entire cycle starts over. This icon grid details the specific physical side effects. Marcus will experience extreme cold sensitivity, a skin rash, severe fatigue, and a shift toward eating small, room-temperature power snacks. These symptoms are expected signs the medicine is working. While these physical burdens are difficult to endure, they are entirely expected. In fact, these side effects are tangible positive indicators, proving that the targeted therapy is actively destroying the cancer. This graphic maps out the first half of the 14-month master plan. It begins with the current 12-week chemo block. That finishes with a major scan to measure how much the tumors have shrunk. If the scan is clear, he enters phase 2, major surgery to clear out both the bowel and the liver, followed by 2 uninterrupted months of dedicated healing. Here we see the second half of the year. Phase 3 is a final round of insurance chemotherapy, guaranteeing no microscopic cancer cells remain. Phase 4 requires several months to restore muscle mass and full nerve function to his hands. A cure is a marathon. Setting realistic expectations now means understanding that Marcus will likely not return to the physical demands of full-time plumbing until mid to late 2027. This slide illustrates the severe emotional transition Marcus is facing. Due to the high risk of infection, he has had to down tools and stop working indefinitely. After more than 30 years of highly physical labor, transitioning to a stationary life where he cannot do anything for months is a massive psychological challenge. The entire household routine for Marcus and Debbie now completely revolves around the hospital calendar. This document lays out the exact rules of engagement. Rule 1. Present a unified front. For Malcolm, Lois, and the extended family, this is a waiting game. Your job is to stay the course, focus on the cure, and be a steady presence. Rule 2. Protect the inner circle. Marcus and Debbie must focus 100% of their energy on the treatment. The wider family should share updates amongst yourselves to prevent overwhelming Marcus with questions during his heavy treatment weeks. Rule 3. Patience with the process. Respect the silence. Marcus needs space to adjust to this grueling environment, and the family must let him and Debbie completely dictate the timing of all calls and visits. As this final slide summarizes, the medical plan is in place. The clinical intent is a cure. The family's most crucial job now is to provide the space, patience, and unwavering support needed to see it through.